Bovine lumpy skin disease, LSD. Lumpy skin disease, LSD, is a highly infectious viral disease of cattle and buffalo characterized by pox-like intracutaneous firm nodules, edema of the limbs, swelling of the superficial lymph nodes, and lymphangitis. Etiology: Lumpy skin disease, LSD, is caused by the lumpy skin disease virus, LSDV, a virus from the family Poxviridae, genus Capripox virus. Transmission: the virus is present in the nasal and lacrimal secretions, semen, and milk of infected animals. However, direct contact is not thought to be the major source of transmission, with most cases associated with transmission by an arthropod vector. Clinical symptoms: painful swelling, fever, lacrimation, nasal discharge, and hypersalivation followed by characteristic eruptions on the skin and other parts of the body are characteristic. The nodules are circumscribed, round, slightly raised, firm, painful, and involve the entire cutis and mucosa of the gastrointestinal, respiratory, and genital tracts. The regional lymph nodes are swollen, and edema develops in the udder, brisket, and legs. Secondary infections may cause extensive suppuration and sloughing lesions. Diagnosis: the widespread nodular lesions of the skin and mucus, membranes, and biphasic fever are indicative. Drug treatment: there is no effective treatment, but secondary bacterial infections are prevented by the administration of broad-spectrum antibiotics. Prevention: vaccination with sheep/goat pox virus or LSD strain. Reproductive tract. Gilt anatomy. Terms: bladder, muscle structure that stores urine from the kidneys via the urethra. Cervix, the muscular junction between the vagina and the urethra. It is the site of semen deposition during mating. Infundibulum, a portion of the oviduct that may be referred to as the fimbriae. The thin, membrane-like structure that surrounds the ovary. At ovulation, it funnels the ova, eggs, into the oviduct. Ovary, the primary reproductive gland of the female. It produces ova on a cyclic basis, every 21 days, and secretes the female hormones estrogen and progesterone. Oviducts, also referred to as the fallopian tubes, serve as a site of fertilization and provide a passageway for sperm and ova. The embryos reside here for about 2 days before they are transported to the uterine horns. Urethra, tube which connects bladder to vagina. The urethral opening is about 2 inches anterior to the vulvular opening. Can be traumatized by the boar's penis or by improper insemination technique. Uterine body, the portion of the uterus between the cervix and the uterine horns. Uterine horns, paired Y-shaped tubes, which connect the oviducts to the uterus and cervix. Muscular contractions provide for sperm transport to oviducts. Site of fetal development. Secretes prostaglandin, which is involved with a regression of the corpus luteum. Vagina, a muscular canal that extends from the cervix to the vulva. Serves as a passageway during parturition, farrowing, and urination. Vulva, external portion of the reproductive system. Usually becomes reddened and swollen prior to estrus as a result of increased blood flow stimulated by higher estrogen levels.